So where are you going right now?
After this, my fiance and I are taking a dance class. Actually.
Tell me how this is. What happened? What happened?
I met him at physical therapy after my surgery. He was a tech at the time, and so like, he would flirt a little bit, but nothing.
So Spine Center had something to do. Oh,
You know who takes credit for it is Pam.
Pam.
She's like, well, I introduced you to Lydia, so it was mine.
Well, I called Pam. I said, Pam, do you think it would be okay if I call Yvette? And I said, yeah, of course. And they said, you do know that this relationship would have never happened without me, right? And I said, Mama said, do we need to give you credit? She goes, 100%. And she loves it. Okay, so tell me what happened. This was after surgery. Mm-hmm. And then?
So I went to therapy. I'd gone to spine and rehab before at the Zaragoza clinic. Yeah. But I had to go to the Edgemere one because it was closer to work. So like, we would flirt a little bit, but he couldn't ask me for my number or anything. He's like, I can't, you're a patient, you know? So I was like, well, it's not going to work. But then my best friend and Pam, of course, kept telling me, just call him, just like have the guts and call him.
If you initiated it.
Yeah. So I was like, fine, I'll do it, which I never do that, but I did it. And so yeah, we started dating, and then he got into PT school. So our whole relationship has been PT school pretty much. But he just graduated in December, and we got engaged the night of his graduation.
Congratulations.
Thank you.
We had something to do with this engagement. I'm so happy.
Yeah.
Okay, so I'm going to ask you a bit before your surgery. Do you remember those days?
Oh, yes.
Okay.
Definitely.
How were they? Can you tell me a bit about them?
It was pretty painful. Every day I had pain. We would go to the mall, for example, the grocery store, and it was like, after 10 minutes, I'd have to find a chair and sit down for a few minutes and kind of rest. But I always had low back pain, and it radiated all the way to my leg.
Okay.
So
I remember we had a conversation one day about your heels.
Yes, I always have to wear comfortable shoes, like old lady shoes.
Can you wear heels again?
Yes, I can.
And you're back to normal? You're working out at the gym?
I'm working out now, yes. I couldn't work out at all before. I could barely walk.
Yes. So if you were to say what has been the biggest change, what has been the brightest thing coming out of surgery, I guess?
Honestly, which sounds so simple, is walking. Like, I can walk long distances. I can do a 5K. I go hiking now. When before it was like, we go to the mall, like I said, every 10 minutes you're stopping to rest because my back hurts. So it's just the little things that you take for granted.
That now just say, I love this.
Yeah.
And it was what, 2 years ago?
It's actually going to be 4 years in this month, at the end of this month.
4 years ago. We met 4 years ago.
Yeah.
So 4 years ago we met at our nail tech, Pam, of course.
Yes.
And we started talking, and I remember shoes was our first conversation.
Yeah.
I remember that was our first conversation.
I would always go out, and everybody had the prettiest heels, the prettiest shoes, and I was like, uncomfortable
and
shoes.
You were contemplating selling them at that moment.
Getting rid of them, yeah.
And I remember looking at you and say, well, how much do you have in your collection? How many pair of shoes? And you said, I have so many, and I've collected some for such a long time. And I said, well, why would you want to sell them? And you said, well, I can't wear them. I've tried, but I can't wear them. And from there it just went on, and then I remember we met your mom.
Yes.
Lovely, lovely woman.
Thank you.
And then she was nervous. You were both nervous about surgery. Because I think it's so scary. Do you think it's scary when you're going through the process?
It is. I'd had back pain for more than 10 years already. And I had some doctors tell me, oh, you need surgery. But I was in my early 20s. I'm like, no way, you can't have surgery. But so yeah, it's really scary, and you hear, of course, all these terrible stories of people who...
Everybody loves to tell you terrible stories.
Yeah, nobody tells you the good stories.
No one tells you the good stuff.
So I heard all the bad stories and how people didn't come out right, and they're never the same. So I was scared. I really was. Yeah, he's just really sweet, really nice to talk to, and he explains everything to you and how you can understand it. Not most doctors explain to you and you have no idea what they're saying. You know, it's
so
like
you understood him.
Yeah, definitely.
Put you at comfort.
Yes.
And then after that, recovery. How was recovery? Was that tough?
The first week or two, it was really frustrating because all I could do was walk around my house a little bit. Of course, my mom didn't let me do anything. So the first week or two was frustrating. You're at home. But after that, it was easy. It wasn't really as bad as I thought. Pain medicine, for example, I took maybe the first 2-3 days, and that was it. I didn't even need
I think
everything.
I was so happy when you told me that. I think that is what made me the happiest.
Yeah, it was awesome.
I know that, again, we became friends at such a small period of time, but it was just, I was so happy because I saw you before and I saw how it had affected your life.
Yeah.
And I remember I kept telling you, you're such a bright, beautiful young lady. You can't be satisfied with this. You can't settle for this. And we finally convinced you. I know Pam and I finally convinced you and got you in. And then it all went so fast.
It did.
Before I knew it, you had been operated. And now I know that you went to therapy and you got engaged, and that makes me so happy.
Thank you.
And I know that, I remember I always keep up with you with Pam. I said, how's Yvette doing? And I remember she told me, she was like, she's at the gym, she's lost all this weight, and she got her back life. And I remember one day, or I think I even texted you, or we were talking about it, I was like, are we wearing heels again?
Yes.
And I remember you said, I didn't have to sell one, and I'm wearing every single one of them again.
Yes, it's awesome.
That was awesome.
Yeah.
Would you do it again?
Definitely.
Now that you know the outcome, now that...
Yeah. Like I said, I've had back pain. I want to say probably since middle school I had back pain, but the doctors would tell me, oh, it's just growing pains, or you're a little bit overweight, that's why it hurts. So you kind of accept it. And in high school is when I found out I had problems with my discs. So I just kind of accepted it. The doctors said, you know, either you're on pain medicine and injections or you have surgery. I didn't want surgery because they made it seem like a big, major procedure.
And your scar, how big?
They're 2 tiny little scars. You can hardly see them.
An inch, half an inch maybe? Or a little bit
Maybe
bigger?
an inch,
An inch?
I would say, yeah.
And
on either side of my spine, and
no
hardly
big deal.
notice them. No.
Isn't it, again, people talk about spine surgery, and they make it look like you're going to be in crunches, in braces. You're not going to be able to live a normal life. You're not going to be able to go hiking, which I know you love to do.
I do now.
Or just shopping for
Exactly.
pretty little things. And you have to worry about, can I wear these shoes, or can I carry this purse? Or, so
Exactly.
I think, yay.
Yeah, it's awesome.
Okay.
I'm happy.
Awesome. When's your wedding?
In February.
Is it really?
Yes.
February?
The 25th.
Is it big, little?
Maybe like 120 people.
That's
not too
pretty.
big.
You don't think that's big?
For El Paso. It's
For Hispanics?
for Hispanics, it's not too
So
big.
you made it a small, and your mom, is she just ecstatic?
She is. She's excited.
Is she excited?
Yes, she helps me plan.
Does she? So
She
she
does,
all
it's great.
into the details and stuff?
Yeah, she is.
I'm very, very happy for you.
Thank you.
Thank you so much for doing this.
I'm telling you, since I was young, they wanted to do surgery. I'm like, no.
I am glad that you waited till all the new stuff came out.
I'm really glad I
really
waited.
am glad that you waited till all the new minimal invasive stuff came out. Because before, the incisions used to be about...
My grandma had
this-
back surgery, and it's like all
Yeah,
down
it
her
used
back.
to be that long. They've ruined tattoos, and then they would go in, their recovery would be a lot more. I mean, you would stay in the hospital for 3 to 4 days. So I am glad that you waited till
Me
all the
too.
minimally invasive stuff, because you have like 2 little scars and that's it.
Right after surgery, I want to say that I woke up and like not even an hour or 2 afterwards, I'm like, I need to use the restroom. They're like, well, stand up and go. And I said, you want me to stand up? I just had surgery. Well, yeah, just stand up and walk. Of course, they, help you and
They
hold
help
on
you a
to you
little bit.
because you're on all this medication. But yeah, I couldn't believe it. And I was able to walk fine.
So how long were you in the hospital?
Just overnight.
Just overnight, and the next
I was
day you
out the
went
next
home?
day by noon probably. That
Did
was
you want
home.
to punch him at any moment because it hurt so bad?
Not
Probably
really.
no?
When I think the first few days when I was sleeping at night, I'm used to sleeping on my stomach. So that was the hard part too.
That was hard for
And
you.
when I would try to turn from one side to the other, it was painful.
Okay.
I think that was the only time I really had pain after surgery, was sleeping. Because you're in the same position for 8 hours.
For about